Hi, my name's Rik Bryan, and I'm the Director of the Bladder Cancer Research Centre at the University of Birmingham. Bladder cancer is the 10th most common cancer in the United Kingdom. It's actually the 5th most common in men and the 11th most common in women. And that means well over 10,000 new cases per year. But despite representing over 3% of all new cancer diagnoses, bladder cancer receives less than 1% of cancer research funding. And that's not just the situation here in the United Kingdom, but it's the same across the rest of Europe and North America. And as a result, bladder cancer patients have not really experienced the breakthroughs that have been witnessed in other cancer settings, and outcomes from the disease have changed little for the last 20 or 30 years. We still use surgical techniques that are decades old. We use drugs that have been in existence for 20 or more years. And some of the drugs that are pillars of the treatment for bladder cancer, such as BCG, have been subject to real difficulties with supply for the last 8 years or more. Also, the patient pathways are prolonged. The time period from diagnosis through to definitive treatment in some cases can be well over 100 days. So there are very many challenges facing bladder cancer patients and bladder cancer research, and that's what we hope to address through the Bladder Cancer Research Centre here at the University of Birmingham. We are a strategic grouping of translational and multidisciplinary researchers. Translational means that we aim to use biomedical discoveries to generate new tests and new treatments, to undertake clinical trials that demonstrate whether they work or not, and then to get those new tests or treatments into the clinic as soon as is safe and acceptable. We're multidisciplinary because our centre spans a number of different scientific disciplines, from biomedical research through to mathematics, engineering, and clinical trials methodology. Our core research themes are proteomics and biomarkers, genomics and bioinformatics, novel therapeutics, biomedical engineering, and clinical research and clinical trials. And all of those themes are aiming to address some of the research priorities that have been identified by both bladder cancer patients and healthcare professionals treating bladder cancer patients. So proteomics and biomarkers, using the protein changes in urine and blood that accompany bladder cancer to try and develop new tests that better predict how an individual patient's tumor might behave. Genomics and bioinformatics, using our own data from DNA and RNA sequencing, as well as those other data sets that are available in the public domain, using such data to gain new insights into the disease, also to develop new biomarkers that again better predict how an individual patient's tumor might behave, but also to develop diagnostic biomarkers such that the disease can be diagnosed and followed up from either a urine test or a blood test, rather than a camera inspection of the bladder, flexible cystoscopy. Novel therapeutics, we know that we've been using drugs such as mitomycin and BCG for decades, and they're effective in many patients, but perhaps not effective enough, and perhaps it would be good to have a wider choice within our armamentarium. And so for a number of years, we've been working with the Structural Genomics Consortium at the University of Oxford and have screened hundreds of agents that could be new drugs, and many of those drugs are moving forward into further development. Biomedical engineering. Some of the instruments that we use to shave tumours away from the inside of the bladder have their origins over 80 years ago. And so we're developing new devices that can improve the functionality of our existing instruments, but also developing entirely new ways in which bladder tumors can be treated from within the bladder. And of course, clinical research and clinical trials. So what are the patterns of disease? How are the patterns of disease changing? What are the factors that influence how well patients do, what their outcomes are? And clinical trials in order to test new approaches, whether they be new tests for risk stratification or for non-invasive diagnosis, or whether they be new therapeutics, but carrying out the clinical trials that can move the scientific discoveries into the clinic much more rapidly. So translating biomedical science into healthcare benefits for bladder cancer patients. Now, of course, here at the University of Birmingham, we can't do it all. We've outlined our areas of expertise where we have a strong track record, but equally there are some areas of research where we have less experience. And so we hope that our research centre will also act as quite an outwardly facing hub to try and coordinate bladder cancer research activity, both in the UK and beyond, to connect researchers who have similar interests and to help them push forward with those interests, with those ideas, with those innovations, really to be a hub that can coordinate improvements in care for bladder cancer patients. Thank you very much for listening.